even though it says private, because it's recorded, is not actually private when we put the recording out. So I'm going to be doing the talking for a few minutes, and then we're going to, I'm going to stop the slides, and Chris is going, who is the volunteer in the room, is going to put up a Word document, and he'll sort of make notes and record as we go along what he's hearing. And then at the end, we'll take his notes, and you have, of course, because you can see them, the chance to say, no, that's not really what I was saying, or that's not quite right, or you didn't get this, or something. We're not looking for a complete record of everything that's said. We're looking for what are the kind of the highlights, the key points that are emerging. And the question that we want to focus on are what are some key implications for public health action of the material I'm going to be presenting. At the end, we'll have 5 minutes to summarize it, and then we need someone, myself or Chris or one of you as a volunteer, to, when we go back into the plenary session, share a PowerPoint slide that Chris will put together of the 3 to 5 key points. So any questions on that before I begin? Okay, so this is the, whoops, this isn't the topic. Sorry, I put the wrong one up there. That was interesting. Let me try this one. Nope. I'm going to have to quit the other one. That was the one for this afternoon, so you almost got this afternoon's presentation. Okay, that should be better. Now let's try again. Good. Can people see that? Chris, can you see that? Yes, okay. So this is about pollution, ecotoxicity, and health in the Anthropocene. So this is a definition of pollution that was developed by the European Union, and a lot of my remarks are going to be focused on and draw from something called the Lancet Commission on Pollution and Health. And this is a definition of pollution. It is unwanted, often dangerous material that is introduced into the Earth's environment as a result of human activity, and it threatens human health and it harms ecosystems. So what you've got in there is a number of different ideas. It's a material, doesn't have to be a chemical, could be radiation, could be solid matter, but it's something we introduce, and it threatens both us and the ecosystem that we depend upon. So this is the Lancet Commission. You can find it if you just Google it, the Lancet Commission on Pollution and Health. And it was a very comprehensive overview of global pollution issues. This was the most dramatic finding to come out of their study, and it was headed up, incidentally, the commission was chaired by Phil Landrigan, who some of you may know is a long-term researcher on environmental health and done a lot of work on lead pollution, in particular in children, and a lot of work on the health impacts of pollution on children. They estimated that pollution was responsible for an estimated 9 million premature deaths in 2015, which is 16% of all deaths worldwide, much greater than had previously been estimated. And they noted that it's 3 times more deaths than were caused by AIDS, tuberculosis, and malaria combined, and 15 times more than from all wars and other forms of violence. So we have, for the last couple of 100 years, actually, underestimated and largely tried to hide and pretend we don't see the deaths due to pollution. And so that's what they are getting at. The other really important point they make, and this is from the report again, is that pollution disproportionately kills the poor and the vulnerable. And you heard some reference to that in Maya's presentation and also touched on in Shannon's. there is this notion of environmental injustice, or in the US, they actually call it environmental racism. So pollution disproportionately kills the poor and the vulnerable. 92% of pollution-related deaths occur in low-income and middle-income countries, and it's always more prevalent among minorities and the marginalized. So in the US, among Black and Hispanic, in Canada, among indigenous communities and racialized communities. And we only have to think of the litany of examples from Grassy Narrows to the pollution around the Chemical Valley, Sarnia in Ontario, and so on, to know how many examples of this there are. And the other really important point is that children, for a variety of reasons, are at high risk of pollution-related disease. So that is also a challenge. And they came up with this notion, which I present here, of what they called the pollutome, which is a way of thinking about the forms of pollution that are out there. And the really important point here is that they have three zones. The first zone are for those where it's well-characterized health effects of well-studied pollutants. That is where the 9 million figure comes from, of deaths. But zone 2 is emerging but still unquantified health effects of known pollutants. So because the data is still emerging on health effects, they're not quantified, they're not included in the estimate. And zone 3 is inadequately characterized health effects of emerging pollutants. Think of persistent organic pollutants, think of microparticles, nanoparticles, things like that, that we don't really have a good handle on at all. So neither of those two zones are included. So that estimate of 9 million deaths is almost, well, it's definitely an underestimate. We just don't know how big an underestimate is. So at least 16% and quite possibly quite a lot more. I should say that many of those deaths are due to air pollution, which I'm not sure if it's a point I'll come to in a minute or not. So this could be the tip of a much larger iceberg because we're not including the deaths in those other zones. And then on top of that, or not on top of that, as a part of that, we have a phenomenon that I think has been largely disregarded by public health, and we haven't paid enough attention to, the notion of ecotoxicity, which was a term, I'm not sure if Ross Hall and Donald Chant created it, but they did a report in 1979, so we're talking more than 40 years ago, for the Science Council of Canada on it. And they described ecotoxicity as the enormity of tinyness. We forget that very tiny levels are biologically significant. So for example, estrogen levels as low as a few parts per trillion can be active, biologically active. So we tend to live in a mechanistic world where if you're building a bridge and you're out at the end of it by 1 part per billion, you're probably talking a centimeter or two over a 5 kilometer, 10 kilometer bridge. Who cares? But in biological terms, that matters a lot. Then there is the phenomenon of bioconcentration, that persistent organic pollutants, I'm just going to close my door, I forgot to do that, before we get visited by my dog who just came back from her walk. Bioconcentration, so that those very low levels, Mother Nature represents them to us, concentrates them up the food chain, and guess who sits at the top of the food chains? And here's an example that the difference in PCB levels from water to seals is 80 million times. So when you eat that piece of seal, if you're an Inuit up in the Arctic and you eat seal, you're getting something that is 80 million times more concentrated than is in the seawater. So that's the phenomenon of bioconcentration. Then, of course, there's multiple chemicals. And this, notice, is a 20-year-old study. 196 different organochlorines been identified in the tissues of North Americans, and several hundred others detected but not chemically characterized. And then we know that they contaminate up food chains. So we forget that most of our exposure to these things is not from air or water, which is where we tend to focus our concern, but in fact food. And then children, they are proportionately higher exposed than adults because they eat more and drink more and breathe more kilogram per kilogram. They also behave differently. They crawl on the floor, they breathe at tight tailpipe levels, consume significant amounts of soil when they're young, they indulge in risky behavior. So for a whole variety of reasons, their metabolic systems are immature, the child's brain is growing rapidly and they're sensitive to disruption. That's particularly true of the brain, but also endocrine, immune, reproductive, respiratory, and other systems are all still differentiating and maturing. And they also have many more years of life ahead. So when you're born with a body burden of persistent organic pollutants, what does that mean for your health and life expectancy? And the answer, generally speaking, is we have no idea. So the question then is, what are the health impacts of hundreds of persistent organic pollutants and other chemicals present in the body from birth? And the answer is we really don't know. So my question for our discussion is, what is public health doing about this? What should it do? What should we do locally or provincially or nationally or globally? So I would suggest we focus on, I'll just put that one up again, we focus on this question of what is public health doing and what should it do about the issue of pollution and ecotoxicity. And we have, I'm happy to say, 35 minutes left. There's a little clock, if you look at the top of your bar, I think it will tell you how much time we have left. I will stop sharing and I will throw it open to the folks we have on. If you want to speak, please, if you want to speak, please put your hand up or wave, or initially just try speaking. Thoughts or comments, questions, clarification? And Chris is going to keep some track of our discussions through what he's just sharing on the screen. So with things we can do as citizens, things we can do as professionals, things we can do as an organization to address this problem of pollution and ecotoxicity.
Trevor, it's Gordon Miller here. And thank you for that. I always find your presentations inspiring. You know, to me, I guess being somewhat illiterate pertaining to this major health issue and concern, I just don't understand, you know, I don't realize the severity of it as much as I should. One of the questions, though, that I want to be able to ask is, what's happening with some of the current research when you're looking at these minute, you know, particles, as you're saying, and the effects that they have? You know, you said we don't know, but surely there must be some emerging research out there that is taking a look at the contraindications of this.
Well, I think the problem is that a lot of the research tends to be one chemical at a time. And so you will be told that, well, you have a quote unquote safe level of X, Y, Z. And that's because, and it's certainly in the interest of industry, and I would say generally has been in the interest of government, to only look one chemical at a time. But the reality is that you are carrying a body burden of couple of hundred of these persistent organic pollutants. Now you can add to that nanoparticles as well. And what we really don't have the scientific ability to do is to look at the totality of that. I mean, the only way really to do it is to look at population-wide impacts, but even then, the challenge is that it's very hard to find a control population. Everyone is exposed. One of the more shocking findings some 20 or 30 years ago was that some of the highest levels of PCB in breast milk on the planet were found among Inuit women in the Arctic, who are very, very far removed from the sources of PCBs. And what was happening is that there's a process called distillation, pollutant distillation, where these volatile chemicals tend to concentrate in colder areas because they precipitate out and then it's too cold for them to revolatize. And also they get into food chains. And as I showed you in that slide, if you're eating seal, you're getting a very high concentration of pollutants. So you would think that maybe a good control group would be people far away from pollution, but that's not the case. So we don't have a control group. We don't have the ability to really measure long-term impacts. My suspicion would be that some of what we see around particularly breast cancer, which is a fatty tissue that's very susceptible to, therefore, persistent organic pollutants because they bioconcentrate in fatty tissues. That's why, incidentally, a benefit of a low-meat diet is that you have less animal fat, and we know that they concentrate in fats as well as concentrate up food chains. So for all those reasons, it's just very hard to study. So that is why what we really need is to bring in something called the precautionary principle. We've had this approach that has said a chemical is innocent until proven guilty. We should really flip that around and say a chemical has to be presumed guilty until you can show, you probably can't prove it's safe because you can't scientifically do that, but you can show its very low level of risk. But again, if you do that one at a time, you're missing the big picture. So it's a real challenge. So really what we have to do is reduce our overall exposure to all forms of chemicals, starting, I would say, with the big ones. If you look at what kills people most of all in terms of pollution, though, it's air pollution in middle and low income countries. Think of the levels of air pollution in Delhi or Beijing or places we hear about all the time on the news.
Yeah, great answer. Thank you.
Other comments or thoughts?
Hi, it's Kemi Demola. Can everyone hear me?
Yes, we can hear you, Kemi.
My question is, it's been known over the years that as one chemical gets discovered as not being safe, people kind of move towards that which is presumed safe. And then before you know it, that gets declared as unsafe. So I am not too familiar with this area, but just to kind of pick your mind a little bit, where do you think as humans or as individuals listening, I haven't heard what you've shared with us, and thank you for that, is where do you think we could start? Because it seems really big and out there, and even people that start in their home, as I kind of mentioned earlier, you start using one thing that is deemed natural and safe, before you know it, it's tagged onto something else that is dangerous. Even speaking about the pots that we use and the lining and the coatings of those pots. So I will leave that over to you.
Well, I think that at an individual level, you just have to be suspicious of everything, in a sense, and as a result of that, a precautionary principle is, don't use around your home pesticides or dangerous chemicals. Now, they are going to be there. They're going to be, that is the problem. They're going to be, there's a phenomenon known as outgassing, where paints and solvents and materials used in particle board and flooring and all kinds of fabrics are doused with chemicals or used a lot of chemicals, and particularly in the new car smell or the new home smell, that is the smell of those materials outgassing. So there has been a shift in the building industry to low emission paints and low emission solvents and varnishes and glues and so on. But natural is better, synthetic is generally worse. And you're right about something being discovered to be dangerous and replaced by something else, which then also turns out to be dangerous in different ways. And we've seen that on a number of occasions. So I think really what it means is a very high index of suspicion, and the application both individually and at a societal level of the precautionary principle. Look at purchasing policies of the organizations you're part of. Do they have a purchasing policy to avoid synthetics and avoid unnecessary chemicals? There's a lot of stuff out there that really you don't need for a decent life. So how do we reduce our individual exposure? But then there is also the societal responsibility. And so we need, as organizations, both locally and provincially and nationally, and internationally for that matter, to be pushing for hard, tougher regulations. Much as we had to do with tobacco, we have to have the same fight as we had with tobacco with the chemical industry.
Thank you.
Are there people who have been doing some of this sort of work and taking on these issues? Are there people who've been either taking their own steps to reduce their chemical exposure and that of their families, or working professionally or as citizens on these issues? Dion, I see your hand up.
Yes, I guess I'm trying to reflect individually. I've known about kind of all of the preservatives and such that are put in foods to increase shelf life, but then also not just foods, but even your soaps maybe that you use for your hair, on your body and such. And so I came across a lady locally in Vancouver that teaches you how to make your own products. And it's everything from cleaners to makeup to hair products to soap and such. And I found it exceptionally empowering because not only can you walk out, she like guides you through the process, teaches you kind of the chemistry. She walks you through the whole process, and you walk out with products that not only are specific to you, but you know exactly what's in it. And she really empowers you and say, look at the products, look at what's being put into it, and be critical about it, because a lot of it is filler, it's not needed, and so much of it is harmful. And so I just have been trying to even encourage individuals around me to know about these classes if they're interested. So I'm kind of thinking as trying to empower people at an individual level to really be inquisitive about their exposures and what they can be in control of. So I just kind of wanted to share that because I think that's a place where we can start to link people into those opportunities to be in charge of what they're exposed to. So like she did it as a mind frame of everything that her family is exposed to, from a chemical cleaner to what they use on their body to moisturize or keep them clean. They now know exactly what's in it, and they source ethical sources. She really does it ethically, looking for products that are done in a right way, or at least not contributing to other harms, such as palm oil. So she ensures that there's no palm oil, and really tries to educate people about the destruction of the harms to the orangutans and kind of that connection to the earth and such. So I just kind of wanted to share that as a way that individually people could start to look at things. And if they couldn't take those courses themselves, they could find those individuals that are making those products that are maybe more ethical and healthier for us.
Thanks. And I would say a couple of things in general based on that. That first of all, and I have said this for many years, the environmental organizations, groups like Pollution Probe and the Suzuki Foundation and so on, have been doing in many ways the job of public health in the area of environmental health for a long time. Public health is coming late to the party in terms of our action on these issues. So allying yourself with and joining environmental organizations, working with them, learning from them, supporting them, both as in your capacity as a citizen and your capacity as a professional. And secondly, if you're not speaking, could you mute maybe, because we're getting some feedback. Secondly, that there are ethical purchasing policies that are available. So you might want to find out whether your organization, organizations you work with, have got ethical purchasing policies, green purchasing policies. If you're working in healthcare, take a look at websites such as the Canadian Coalition for Green Healthcare, or in the international group, Healthcare Without Harm. They both have lots of advice on how to purchase ethically and operate ethically within healthcare systems. Now, I see R. Wheeler. I'm not sure. Sorry, I don't know what the R stands for with your hand up. So over to you.
It's Roger Wheeler, Trevor. Can you hear me okay?
Hello, Roger.
Hi. Less about action and more just a question for you. I'm wondering if you know of a connection between consumerism and the issues with toxicity. You often hear about lower income people who are in environments where they are exposed more greatly to toxins. But when we talk about the stuff that's in the products that we consume, and then we think about the folks that are at the higher income levels that are consuming a very large variety of products and services, that I'm just wondering if you're aware of anybody who, or any results, any studies that have shown that there's actually a connection between consumerism and toxicity.
Well, a couple of things I think there. One is, in general, the wealthier you are, the bigger your ecological footprint, and therefore the greater harm you do to the planet. And that applies whether you're an individual or a country. So some work was done some years ago, 10, 20 years ago now, 10 or 15, I think, looking at the ecological footprint by income in Canada. And high-income Canadians have an ecological footprint about 2.5 times that of low-income Canadians. And so that footprint is going to include, Roger, maybe you can mute yourself, because I think we're getting feedback from you. Yeah, thank you. So that includes their sort of chemical footprint, if you like. And might even be I've never really quite thought about it this way, but one of the problems actually with the ecological footprint is it's limited in its assessment of things such as chemicals. You can't convert persistent organic pollutants into hectares of land needed to absorb them because they're persistent and they're not absorbed. Or they are, but they're absorbed and then bioconcentrated. They don't break down. That's why they're designed not to break down. That's why they're persistent. So either directly through your use of chemicals, or indirectly because in consuming large amounts of goods and services, you are also having other people work to produce them. So that means your footprint is both directly and indirectly much larger. So yes, there's certainly that sort of linkage. And then, as you say, the other big problem is inequalities in terms of, I have a sort of standard mantra I run through, that the poor live downhill, downwind, downstream, in the worst neighborhoods with the worst housing, doing the worst jobs. And so they are far more exposed than high income people living in nice new, not necessarily new homes, but nicer homes, better quality neighborhoods, generally safer jobs, and so on. So it's these two things combined. Other thoughts or comments?
Hi, Betsy here. Can you hear me?
Yes.
Is there something about the discourse that could be improved, and it would apply to all levels? And it's about, what's been done with public policy in public health for a long time is actually start around the genesis, and to start with what are the benefits for what has happened. What have we got from getting to this place, and then go to the costs and the gradients, and then to invite all people to ask the question, is it worth it? And then what can one do about it at what level? But it's because this has been an issue my whole adult life, and that's a big time frame now. There's a weariness, there's a sense of helplessness, all this. So it's almost like simplifying the storyline, but starting with, yeah, this is what has the benefits have been, and to whom, and has this been worth it?
Sorry, I was muted. You have to look at both benefits and costs. And again, one of the other standard mantras is, the people who get the benefits usually don't shoulder the costs. And so in looking at benefits, you have to look at costs at the same time, obviously. But I think that there was a slogan back in the 50s, I think, Dow Chemical or one of those big chemical companies, and it was a better life through chemistry. And this notion that, we saw it particularly with pesticides and herbicides, and, the way to get a perfect lawn is to zap it with all these herbicides and kill all those things that aren't grass and so on. To what purpose? What's wrong with a dandelion covered lawn or a daisy covered lawn or whatever? We have to also tap into some of those deeper questions about why exactly are we doing this? What is, as you say, what is the benefit? And is it a real benefit? Does it really matter whether your lawn is green grass or low green daisies? I personally think the daisies look better. But we need to be thinking about what we're doing there and why. Just checking the chat box because I just realized that there's a couple of questions there. So I think that a comment here from Caroline McIntosh, for example, my health authority is too busy dealing with emergent problems to deal with pushing for safety. I think you might want to take a look at the extent to which you are, your health authority has joined, for example, the Canadian Coalition for Green Healthcare, which is an organization I helped set up about 20 years ago. We have to get across. I used to have a friend who used to say, we're so busy dealing with the urgent that we forget the critical. And there's always going to be another emergency, whether it's acute care, opioids, COVID, whatever it may be. But there's also, that group in the US, or started in the US, called Healthcare Without Harm, is based on a principle in the Hippocratic Oath of first do no harm. And when healthcare systems, through their practices, are causing environmental harm and therefore human health harm, then they are not behaving ethically. So there's an ethical argument to bring in here too about, are you really helping the world if you cure this heart attack, but you're busy creating carbon dioxide pollution or persistent organic pollutants or whatever it may be that you're doing in the way of harm? And healthcare systems, remember, healthcare is 10% of our GDP. It has a very large ecological footprint, which has almost never been measured. Other thoughts or comments, anybody? Joy, I see your hand up there.
Hi, Trevor. Thank you so much for calling me. My name is Joy. I'm an SFU, I'm a PhD student at SFU, and my question is, if there are, this is on a global health level, and my question is if there are any health initiative in reducing the pollution, because I grew up in the Philippines, and I grew up in Manila, and Manila is one of the highest densely populated cities in the world, and basically, pollution is a big part of our lives. It's actually normalized there, like pollution with the traffic, our traffic is about 4 hours there instead of an hour travel here. And then also like with the way we consume things, you know, plastic is a very big part of our lives because, you know, it's cheap and that's all we can afford as a developing country. And then also because I'm asking this question, if there's any like, you know, like sort of an organization like International Labor Organization to kind of like police the movement of waste within countries. I'm thinking of this specific case a few years ago, like say, for example, from Canada, that garbage container that was sent to the Philippines and then it stayed there for a few years and then it was eventually sent back here. So yeah, my question is if there are any global health initiatives with pollution.
Well, there's actually quite a lot, starting with the World Health Organization itself, which has a large environmental health program. And actually, of course, in Manila is the headquarters for the Southeast, or is it WIPRO? I think it's WIPRO.
Yeah, I've heard about WIPRO.
Yeah, the Western Pacific region for WHO is headquartered in Manila. Also, incidentally, Healthcare Without Harm, which I have mentioned a couple of times, they have regional organizations as a global coalition. And I remember meeting the guy from the Philippines who was the sort of lead for that region for Healthcare Without Harm, and he was very impressive, and they were doing some interesting work there. So there is there seems to be a belief out there that, well, you kind of have to go through the 19th and 20th century with all of its pollution and poverty and all the rest of it to get to be a high income country, and that's just the quote unquote price we pay for progress. Well, what exactly is the price and what exactly is the progress? And again, who's paying the price? Are key issues that we have to think about so that you don't have to, I would argue, you don't have to go through the 20th century to get to the 21st century. You can maybe skip over it to a fair extent. And just as, for example, we're seeing, you know, they never did lay a lot of telephone lines in Africa because the cell phone came along and people could jump to cell phones. So you have to question the whole notion of what constitutes development and progress in every country. I do think, however, and I think often lost in this, that I think the high-income countries, because historically they have made the greatest contribution to the problems we have, they still are generally creating the largest share of the problem, although the middle-income countries are quickly catching up with them. They have an ethical duty to deal with this in their own countries, but we also need to be assisting middle and low-income countries to make a transition to a green, sustainable economy without having to go through what we went through to get here in the 19th century. I'm not sure how helpful that is, but I think you'll find there's a lot of organizations out there that are working both locally in Manila and in the Philippines, as well as regionally and internationally. The UN Environment Program would be another. Some of the major environmental organizations nationally and internationally. So think about allying yourself with them.
Thank you, Trevor, for those answers. The reason why I'm asking is that, you know, in the Philippines, and I'm all about, you know, like reducing pollution in that country, in our country, just because even though we have existing laws, you know, we have Clean Health Act, but then nothing is being used as of now, because I think it's not part of our priorities as a country, just because you know, there are other things, you know, poverty and, you know, being like employment as well and health. And so, yeah, the reason why I'm asking is that I wanted to find organizations to get started. Thank you.
So folks, I'm just going to point out we have 7 minutes left in this session. When the time is up, and you may see it ticking away on the top of your screen somewhere, we will be automatically booted out. So if you're talking with 3 seconds to go, we're going to hear 3 seconds of what you say, and then it'll be gone. What we would like to do is to see if we can get to any sense of what are some, say, 3 to 5 key points that, and if you look on the screen there, Chris has been keeping some notes for us categorized in these 3 broad areas. Be good to have some thoughts about what are some key priorities, and I'm going to throw that open to you folks as to what you think might be some key priorities. Maybe you can click on and lift up that toolbar so that it's not so big, Chris. I think on the right-hand side of the screen there, you've got an up arrow, which should get rid of it. But anyway, any thoughts about what you've heard that you think are the most important? What grabbed you? What grabbed people as, well, you know, that's interesting, new, different, important, we really should do that? What sort of, what we've talked about thus far gives you that message? You're going to have to just jump in.
Hi, it's Kemi. I think one of the statements that struck me was when you mentioned about PCBs and how Inuit women found to have high level of contaminant, that particular chemical in their system, and how that is linked to the meat or the diet that they take. Especially, I mean, I've been learning quite a bit about the meat and milk industry recently. And it just speaks to the power of those industries and how we, I guess, as citizens and at the local level can hopefully push for, I guess, different diet when it comes to some of the products within the food chain that seem to take on a lot of these chemicals that then pass on to the human. And however, on the other side of that is been brought to my attention regarding the expense or the cost of eating, should I say, natural diet? Mm-hmm. But the argument is health, well-being versus savings, and at what cost is that to humanity? So those are part of the things that struck me in this conversation, and also extending in some of the other information that I am privy to.
Thank you. So, Chris, maybe you can highlight the sort of food chains piece at the top there. A couple of thoughts related to that. One, of course, is that one of the points I made in the slides, about 85 to 90% of the persistent organic pollutants that we absorb are absorbed through food, not air and water. And we haven't paid enough attention to the food chain. Now, the new Canada Food Guide is actually a low-meat diet, if you look at it. And that also has environmental benefits. And also, according to an estimate from the research group in Dalhousie that works on this, it should be cheaper to feed a family of 4 on the new Canada Food Guide compared to the old one. And that's mainly because of it's excluding juices and it's excluding a lot of meat and so on, reducing the amount of meat and so on. So I think diet and behind that, the whole agri-food system is one way to get at this. Other thoughts, folks? We've got 2.5 minutes left.
Trevor, this is Gord again. One thing that really hit me was around the complexity of stress factors that are involved with this. you have the toxic agents that are out there and the potential, certainly for stress, but there's other stress factors that combine with it. And that's what you taught me in looking at other aspects as far as the temperature, and oxygen depletion that's happening in the water exponentially, and just water shortages that we know are happening now. So these kind of things somehow I feel need to be also taken into consideration along with the toxic agents, because they it just makes it more, the complexity has to be recognized. I guess that's what I'm saying. That's one point I have. And the other one, it strikes me that we haven't done a lot when it comes to looking at being able to develop, I think, models out there that could then assess some of these complexities. And so to me, unless we can look at some proper modeling, how are we going to be able to look at best practices in that respect?
Yes, and
just
I think
developing models that are capable of describing, a number of these aspects.
It's that recognition that we live in a complex system, and we need to stop treating it as if it was a very simple thing to fiddle with. Part of that we'll talk about in the session that's coming up with Thomas Homer Dixon, of course. But certainly the idea of comprehensive impact assessments, for example, I think are very important. I'm conscious of the fact we're down to about 34 seconds before we get kicked out. I would suggest another couple of things that to me are priorities are around healthcare organizations acting environmentally responsibly and as models of good citizenship, and because it's ethical to do so, and allying ourselves with the environmental movement.
Yes. Yeah.
Okay, folks, we're down to the last few seconds. Chris, I think you have to hit the stop recording button before we go out of the room. And thank you all very much. Looks like we're getting a note there. We've actually got 48 seconds according to the thing on the screen. Anybody got any final thoughts in those last few seconds?
Hi, it's Melody Monroe. I'm in Burnaby, and I would add just recovery.
Okay, thank you. So Chris, probably the easiest thing at this point is for you to present the feedback on the PowerPoint slide, since you'll have been putting it together. Is that okay?
Yep, I'm absolutely good with that.
Thank you all very much, and we'll see you back in the main session.